Hi there, this is Lindsay Lopez from Southeastern Physical Therapy. I'm joined today by Andrea Furlong. She's a physician's assistant at Tidewater Orthopaedics. Andrea, thank you so much for joining me today. How are you?
I'm doing very well. Thank you so much for having me today.
Absolutely. So I'd like to learn a little bit more about traction. What is it and what is it used to treat?
It is a technique that is done by certain certified chiropractors or physical therapists. Typically, you have to have a very specific type of table that allows a patient to actually lay down and stretch the spine. Now, there's two different ways to do that. One is with the cervical and one is with the lumbar, the lower back. The cervical, a lot of times, the physical therapists, even massage therapists or the chiropractor, they will actually do manual traction where they put hands on either side of the head and just gently stretch the neck. The theory behind traction is that it allows less pressure on your discs and therefore on your nerves. Because a lot of times people have a pinched nerve from a disc that's herniated or bulging. And so traction can actually alleviate that pressure by just doing an upward or a stretch through the spine. The lower back, the lumbar spine, is a lot more difficult than the neck to stretch because there's so many different muscles. It's a lot stronger of a spine standpoint because the bones are larger, the discs are larger. So a lot of times, in order to do traction for the lumbar spine, they have you lay down and they have a special table with weights on either end. I'll get my little spine model here.
Perfect.
That will literally stretch the spine, and what that does is that's going to open up or just alleviate pressure on your discs.
Okay, very, very neat. So I think you probably touched on this a little bit, but are there different types of traction that are utilized?
Mm-hmm. Yeah, so it all depends on where the problem is. So the cervical spine, which is the neck, that's a very common place to do traction. It's very successful. As far as the lumbar spine is the other place in the spine that we normally will do traction as well. But again, that requires a lot more force to distract or get pressure off of those discs than in the cervical spine.
Okay. Okay. So when do you typically use traction and is it painful for patients?
So the times when I use traction is mostly with certain types of pain. So if a patient is having radiating pain down their arms or down their legs, such as from a pinched nerve, which is usually from a disc that's bulging, that's when I'll order traction. If they're having just normal neck stiffness pain or back stiffness and pain, a lot of times we'll do a trial of traction just to see if that would alleviate sometimes the pressure or pain they're feeling. To go back to your other question, I apologize. The different types of traction, there's two. So one is manual. That's where they literally use their hands just to pull or distract your neck or your lower back. The other is mechanical, which is the table.
Okay. Okay.
Yeah.
Thank you. I appreciate you clarifying that. So once a patient, once you order a patient to utilize traction and go through that process, what treatments typically follow that? I'm sure that they vary a little bit depending on what's going on and what the issue or injury looks like.
So traction is not supposed to cause any pain, but if it does, we usually will stop it and then proceed to getting either advanced imaging such as an MRI or CT scan, or we'll discuss medications just to see if there's anything else that's going on, especially with the imaging, to see if there's anything else that's going on that might be not responding or not responded to traction. And alluding to your other question before too, patients usually don't have any pain when they're in traction because it's just a gentle, controlled stretch. But there are the exceptions. There are some patients that do experience pain. A physical therapist or a chiropractor will stop traction immediately if they have pain because that's abnormal.
Andrea, where do you typically see patients?
I see patients both in Hampton and in Williamsburg. And I work 4 days out of the week in clinic and then 2.5 days in the OR.
Okay. Okay, great. If a patient would like to set up an appointment with your office, what do they need to do?
They need to contact our office. It's 757-827-2480, and they can ask for Andrea Furlong. I do see same-day appointments as well.
Okay, great. Yeah, I'm sure patients really appreciate that. It was a pleasure speaking with you and learning a little bit more about traction and how it's used to treat patients. I really appreciate your time. Thank you so much.
Thank you.